Okay, so we're here with Gypsy, and this is, how many times have we dressed this, Sue? All three.
This is the third time.
Good girl. It's okay. Good girl. See how I'm pushing down with my thumb on the skin? Just helps bring the elastoplast off the skin without it pulling too much on the horse. And
I might grab a lump of nose.
yep, that's okay. Let's wait up. Especially if they've had it on for a little while. Up here at the point of the hock, I don't know if you can see, can't see. Up here where I'm pointing here, this is where it gets really sore. So we do have to be really careful and conscious of creating pressure points in areas where we're bandaging that in addition can become a problem in themselves in addition to the wound. The other thing I always try and do is get the tail out of the way by just tying it in a knot. And having considered that she's adequately restrained by her handler, the other thing you can do instead of pulling it off is get your finger in one spot, leverage it off the hair, and then just very carefully use scissors. I actually prefer a scalpel blade, and then you can sort of walk your way around and rub it at the same time, so it's sort of not quite so hard on them. So scalpel blades are something that we had on the shopping list, didn't we, Sue?
Yes, and I forgot.
Because this is actually, it can actually cause a bit of damage, and it's so much slower to do it this way too. So again, find the spot that's loosest so you can pull it away from the horse's leg and try and stay inside the wool so you're not hurting the horse. Ideally, you'd have your handler on the same side as you, and the handler would try to keep the horse's weight on the ground. So there's that. So that there's less chance of you being kicked, because it'll just reduce the time that it takes for her to, it gives you a bit more warning, and it reduces the time that it takes for her to actually be able to kick you. So it's slipped down a bit, but it's been on for what, a week?
Yep.
I don't know if you can see that, but that's actually looking pretty good. So this was actually pretty nasty. Like I said earlier, it's an old scar that's opened up, and the swelling was quite substantial. So the swelling with the size of the leg was probably out here initially, and even though the actual wound at the time looked tiny and there was very little that you could see, the swelling told us that there was quite a lot going on underneath the skin, as a form of infection set in and caused a cellulitis. When we first dressed it, we then found after a few days that it actually opened up this wound enough to allow some of the pus to come out. So our first aid treatment at the time in any inflammation is you want to create cold. Apply cold in the form of a hose if you can, or ice, depending on what the injury is, to try and reverse the swelling. We'll talk more about the process of healing later, but the first point of call was to try and reduce that swelling, which we've done with cold and then compression with the bandage and rest, just till things settle down. But now she probably needs to exercise a bit more, so I'm actually now massaging this leg because I know it's going to be itchy for her, and she's actually quite liking it because it is itchy and it's soothing. But the other benefit in doing the massage is that you're improving the blood supply to the area. You're also feeling for any other lumps and bumps that you may have missed in previous assessment of the injury. So yeah, she likes it. It's helping the healing, and it's also assessing what it is going on. So I know now that the swelling's nearly all gone from the back of the leg. We've still got a little bit here, but that's probably from just the bandage not being quite on evenly as it slipped down a bit. But you're also feeling for anything else that might be going on. Assess here where we've had the bandage up around above the point of the hock, because that's a very severe pressure point here, which can actually, as I said earlier, can create a wound, sometimes even worse than the wound itself. So assessment of the wound. So there's no ooze on the, well, there has been ooze on the bandage, so it's telling it's still leaking, but there's no ooze coming out of it, even with gentle massage around it. So that's good. But sometimes, if you do feel like there is still fluid in there, it's quite good to try and open it up a little bit and try and massage it if the horse will tolerate it, so that you can actually try and get some of it to drain out. Because at this stage, if there is still swelling and fluid in there, you want it out.